Hi everyone, this is Pranav with 573 Medicine, and today I'll be talking to you about the diaphragmatic and retroperitoneal nervous anatomy. So I'll begin with the diaphragm. This will be a quick video. So starting with some landmark structures, we have the central tendon of the diaphragm, which is exactly what it sounds like. It's the central tendon of the diaphragm, this white structure here. We also have the crura of the diaphragm, which can be seen on the left and the right of the diaphragm, just in the medial area. We also have the median, medial, and lateral arcuate ligaments, which are exactly what they sound like. They are arc-shaped ligaments that can go over the aorta in the case of the median arcuate ligament, and the medial and lateral arcuate ligaments go over the ribs here. We also have the most important part of this slide, which are the foramina, starting with the caval foramen, so at T8, and this is where the IVC, or the inferior vena cava, enters the diaphragmatic cavity. In addition to the IVC, the right phrenic nerve also comes through the caval foramen. Next, we have the esophageal hiatus at T10. These vertebral levels are important to remember for these hiatuses, so remember those. The esophageal hiatus is, of course, where the esophagus enters the abdominal cavity, and the vagus nerve courses through the esophageal hiatus as well. And lastly, we have the aortic hiatus, which contains the aorta and the thoracic duct and a zygous vein. One way to remember the vertebral level of the aortic hiatus is T1-2, red, white, and blue. Red being the aorta, white being the thoracic duct, and blue being the azygous vein. So an interesting mnemonic there. And lastly, I thought I'd point out some other structural landmarks here. We have the psoas muscle arising from the L1 through 5 vertebral levels, and this is your major hip flexor. And then we have the quadratus lumborum, just lateral to the psoas major muscle. Next, we have the retroperitoneal nerve structures. I'll just be talking about the nerves. So to begin, we have the subcostal nerve. The subcostal nerve is just inferior to the diaphragmatic ligament here, and the subcostal nerve supplies motor to the rectus abdominis in addition to the intercostal nerves, and it supplies some sensation as well. Next, we have the iliohypogastric nerve, which is just inferior to the subcostal nerve, and it supplies motor and sensation to the area. We next have the ilioinguinal nerve, which can be seen just inferior to the iliohypogastric nerve. I also have the nerve roots labeled right next to the nerve name itself, so beware of those. The ilioinguinal nerve is, of course, responsible for your cremasteric reflex and some sensation in the genital area. We next have the general femoral nerve, which can be seen just medial to the ilioinguinal nerve and coursing through the psoas major muscles. You can see here the nerve roots entering and supplying this nerve. The general femoral nerve is a primarily sensation nerve. Next, we have the lateral femoral cutaneous nerve, which can be seen here. You can see the nerve roots L2 and 3, creating this lateral femoral cutaneous nerve. Similarly, you can see it on the left side. The lateral femoral cutaneous nerve is exactly what it sounds like. It provides sensation to the lateral aspect of both thighs. Next, we have the lumbosacral trunks, which are important because they arise from L1, 2, 3, 4, and 5, and they join up with the sacral plexus here to course into the sciatic nerve and then supply motor and sensation to the thigh and leg. So very important there. And we also have the obturator nerve, just labeled inferiorly to the lumbosacral trunks, just here. The obturator nerve is a sensory and motor nerve. And lastly, we have the femoral nerve, which you can see here, a pretty large nerve arising from roots L2 and L through L4. And it is going to be the major motor innervator of the uh, the extenders of the knee, and it will also provide sensation. And that's all I have for you for this video. If you liked it, please like, comment, and subscribe. And for any comments, questions, or concerns, we have our email listed here. Thanks for your time.